Welcome to Polo University. Hello everybody, Andrew here from Polo Reef. And again, we have Dr. Alex with us.
It's good to be here.
Today we are going to talk about some more diseases. The way we're going to do this series is we're gonna do the diseases first and explain them, and then do another episode or two on medications and the exact doses and how to apply them. Well, last one we did Ick, Velvet, and Brook. And we talked a lot about those diseases. One of the things, doctor, what do you do when you're quarantining a bunch of fish coming in and there is no disease present, but you're prolifically treating for Ick, Velvet, and you have to use one shotgun approach? Is that formalin bath alone when they come in, will that be enough to help them if there's something there in their gills to begin with?
So I would always, one formalin bath I say is never enough. You need subsequent formalin baths and subsequent, let's say you did identify something, you need subsequent skin scrapings showing that there's nothing there. You know, if you treat for a single, let's say we were treating for fluke, again, formalin's not my first choice, but let's say we were, you know, there's certain instances of the fluke actually going beneath the scales, and beneath the scales are not in contact with the medication. So you'd have to wait a certain amount of time for them to emerge from underneath the scale and then for them to be treated. So one bath may not treat every single fluke on them. So they may need subsequent treatments, or in all cases they need subsequent treatments, not just one bath.
This is the last time I'll go backwards here, but instead of taking the fish in and out for baths, why not, like the old days, they used to have medications with copper and formalin actually mixed in the same medication? Why not just hit them with the copper and formalin in the quarantine tank, 1 mil per 8 or 9 or 10 gallons, get the copper up to 2.5. Maybe you use that formalin every day, maybe you use it every other day, but you're hitting them with both, so you're taking care of the velvet potential that way, as opposed to multiple baths.
So yeah, that is a possibility. I believe that the risks for, you know, treatment-induced traumas are higher. The toxicity is going to be higher. Now you're exposing, so the fish is going to be, you know, essentially, you know, poisoned by copper. Even at low levels, we still don't want it all the time. So I try, if I'm using two toxic things, I tend to separate them, because often when you have toxic components, they compound each other's effects. So if I can get, you know, the results I want.
So even a sensitive fish is going to be more sensitive to copper formalin than just copper, for sure.
Absolutely.
But they'll be less sensitive than giving them a bath, going into the copper, then taking them out 3 days later and giving them another bath. That you find that works better?
That's where I tend to lean. One, the bath's concentration in formalin can be higher than long-term immersion. Right. So now you're getting a more effective, stronger treatment, but less amount of time. So it's less stress on the fish. It's, you know, more effective in terms of parasite killing potential. The concentration of formalin in a bath is substantially higher than what I would do for a long-term immersion. And when you have long-term immersion with the copper, again, is that formalin now just, you know, one, it's not at its highest therapeutic concentration, but also at the same time, now you're exposing everyone, you yourself or anyone in the lab, to it for a longer duration of time. And it has, you know, essentially less killing potential than if it did in a bath. So I tend to separate the two of them. I find that, you know, that would be, you know, again, it can be done, but it's not something that I really recommend.
Are you a 2-week clean and clear and pull, or are you keeping these fish in meds for the whole 30 some odd day cycle?
So it depends.
Where do you fall on that?
Yeah, so first, every fish that comes to me has a full physical exam. If I find a parasite on that exam, it goes into one category. If I find nothing, then I'll leave it in, let's say, a lot of times I use copper. I'll leave them in that copper solution. And then every 3 or so days, I'll do another physical exam looking for ectoparasites. If there's 4 consecutive negative scale scrapes, then I'll say that fish is good. And again, and that'll be over a 2-week period. We can always be, you can't ever be too cautious. So again, if you had any concerns, you can always do 5 or 6 negative scale scrapes.
And what about if you're not scale scraping? Is it not true that everything will fall off within 2 weeks? And so that if you move that fish now into a sterile system, it must be good, or not necessarily?
No, so there's certain parasites that do fall off, Ick being one of them. But if you have called viviparous monogenes or viviparous fluke, those actually give live birth on the fish itself. So an infected fish, they'll never actually come off the fish. They essentially just breed on the fish, and that's its host for its life. So those types of parasites will never fall off. So you'd have to treat for them essentially. Otherwise, there's no wait out, there's no follow up. You could take transfer as much as you want, but they're always going to be on that one infected fish. But I think we're going to go into fluke a little.
We are going to do that. We're going to do today. So today's schedule is Uronema, Flukes, and Black Ick. And we're going to talk about secondary bacterial infections, but we're going to talk about bacterial infections more specifically on a separate
now we'll have a full episode tonight.
full episode.
Essentially, we could have multiple videos about.
Yes, we can. Yes, we can. Okay, so let's start with Uronema. Why is it such a problem, and how does it present? The many different ways it presents.
So why is it a problem? One, it's extremely lethal. The mortality rate is extremely high. Treatment is extremely difficult. And in terms of, presentation, there's a wide variety of presentations. So it's really hard to pinpoint, is this Uronema? Is this another, infectious organism? In terms of presentation, again, it's not always linear in the way that they present, and all fish may not show all symptoms, but a lot of times first they start with a gray or dark colored appearance. You may notice the pigmentation is a little bit different. You may notice them flashing, gasping, all the other signs we've spoken about with any external parasite. With any external parasite, you can see, as I said, flashing, gasping, scratching on the rocks, irritation of the skin. With Uronema, sometimes we start to see bruising, and sometimes we see that classic red banding ulceration. Once we see that ulceration, that's not pathognomonic or, essentially, a giveaway that it's Uronema, but it's extremely high, and that should be the number one thought on your differential list, is that this is potentially a Uronema infection. I find that people often confuse Uronema ulcers with Bruxellella ulcers, but a uronemic ulcer essentially starts from the center and works its way out, and you don't have an uplifting of the skin, or you don't have an uplifting of the epidermis. Whereas Bruxellella, you have something called desquamation, and that is where the actual integument of the skin is being destroyed by the parasite, and it starts to lift up and peel away. And in Uronema, we tend not to see that. We tend to just see a cratering ulcer rather than a peeling ulcer. So that would be a good way to differentiate between the two of them.
Why is it so difficult in quarantine tanks? And why do we need sterilization? Because it feeds on detritus and so forth, and there is no fallow period. Why don't you tell us about that?
Yeah, exactly. So with Ick, if we removed all the fish from the tank, eventually all the Ick particles will die out. Unfortunately, with Uronema, is that it feeds off other bacteria. It doesn't need fish as a host. It can live perfectly fine and, without ever interacting with a fish host. They don't need it for part of their life cycle. They don't need it for food. It becomes a secondary food source if they have the opportunity to infect. That being said, treatment becomes quite difficult because there's multiple different ways, Uronema presents as a whole. We have external infections, which is what I was describing about before, and we also have internal infections where it's now in the digestive tract, within the muscle, within the, essentially any organ that they can essentially get a hold of. That being said, there's also been proposed theories that it can get intracellularly or actually get within the cell itself. So it'll, invade into a cell, and that's a whole another can of worms because we can't treat for that. There's no medication. I can't get medications inside the cell because all these cells have different, they're called pumps that will pump medication out of the cell. So become treatment of these intracellular infections is nearly impossible, but this has been proposed. There's been some literature saying that it's possible, but right now I like to focus on the external and the internal because if there's nothing we can do about it, and most people wouldn't be able to diagnose it at home, we can diagnose the internal and the external.
So let's talk about how you would go about treating or preventing Uronema.
So again, everything always starts with a scale scrape. I look under the microscope. do I see the organism there? Is it present? Do I only see one or two of the organism? Do I see, hundreds? Sometimes, and this is a really gray area, because Uronema can be within the tank and not be pathogenic. If I see a single uronemic particle, do you go all hands on deck and get really aggressive with your treatment? And that really depends on, everyone's situation is a little bit different. If I scrape and I see hundreds of them, then I know that those uronemas are part of an active infection. If it's only external, then again, formalin, copper, it does okay. It does definitely help. In terms of internal infection, or once we have ulceration, things start to change. Ulcerations, again, if it's very external, you might be able to get away with copper formalin. But if that infection has invaded into the muscle, it becomes really difficult for those medications to penetrate. So I'm a big advocate of internal infections require internal medication. That being said, internal medications, do you do orally? But, as we've discussed, it's very hard to accurately dose fish orally. So that's where I start to lean into injections. And those injections, again, if there's an ulcer, those injections are accompanied with, the honey we spoke about previously. Sometimes I use a betadine, and it's a cellulose compound. It's essentially like a liquid Band-Aid. I'll cover the ulcer with the betadine and then cover with a layer of that liquid Band-Aid. And essentially, one, seals the fish, and two, acts as an antimicrobial as well. If the honey's not being, not giving me the results that I want, again, or using a combination of the two, you can always put a layer of betadine, put a layer of that cellulose, and a little bit of honey over the top to really seal that ulcer in. Often when we have these ulceration and these infections that are, invading into the body, the fish isn't dying immediately from the ulceration or from the infection. But when we break that epithelial barrier and we're in a salty or hypertonic environment, fluid begins to get drawn out of the fish, and that's something that they regulate very closely. But once we break that barrier, it can no longer be regulated. Fluid begins to be pulled out, and that starts putting tremendous stress on the cardiovasculature and the renal systems. So then once all that fluid's been pulled out, they either go into cardiac arrest or they go into renal failure. And that's what kills them quicker than the actual infection. But again, if we seal that and we prevent that diffusion of fluid out of the fish and we get them on medications, one, they're now sealed. So now they're no longer losing fluid. And that gives us time to get the antiprotozoals into the fish so that now that they can start killing the infection while they're repairing their own epidermis.
What percent of the cases that you see in Uronema are Amphius, Chromis, and which other fish are susceptible, and where do you never see it?
So most often, definitely the Chromises, definitely the Anthias, they're always the ones to start the infection. A lot of times, I'll see Uronema in essentially any fish, but then you trace back and, a couple days ago, I saw a Chromis with a red band across it, or I bought in a bunch of Chromises. It's most often starts with them. It doesn't mean that it always has to. Any fish that's immunocompromised, stressed, malnourished can have it. Any fish that has an open wound, let's say it was, even if you had a tang and it swam by and it got caught on a rock, an open wound is always a site for a possible infection. And that's something that, the Uronema would be attracted to, would be, blood or any tissue exposure in the water. But most often it starts with the Chromises, starts with the Anthias. Again, do see it in tangs. It's rarer. It's not something that I typically see.
Some butterflies.
Yeah, some butterflies. Occasionally, I feel like it's a little more common than just coincidences. I do see it in the fox-faced rabbit fishes quite a bit. Something that I was quite surprised by, because again, is that just because they're fighting with other fish, or when they're brought in, they've all got their spines, they're bouncing around, did they happen to cut each other or something like that?
Right.
And then we have, they're not really susceptible to it, they're just more prone to having an injury, and an injury then allows the Uronema to infect it. Because I think, I'm a big believer that Uronema is present in most tanks. It's probably, impossible to avoid it completely, but it doesn't mean it has to be pathogenic.
What do they do about the internal part? Are they injecting every fish? No way.
So most of the time they're not.
They're feeding them the medicated food?
Well, no. So in terms of internal Uronema, often diagnosis is fairly hard. In terms of diagnostics, it's one, you do a necropsy, you see that it was internal, and then you see other fish exhibiting the same symptoms. So you go most likely. The only way to really diagnose an internal infection in an alive animal is if you're lucky enough to get a fecal sample. So you watch the fish poop, you immediately suck it up, look under a microscope, and then you can actually see Uronema within the gastrointestinal tract. Again, you have to be lucky to get that sample, or if you have an extremely clean, let's say you had a 10-gallon tank and you had some fish in there and you were able to get some droppings off the bottom, that would be a way of diagnosing it.
It comes to you, it's got internal thing, it shows up 5 days later with bruises from inside out, and you're like, oh my God, what am I gonna do?
Yeah, so again, that's when internal infections require internal medications, and that's when I reach for injectable antiprotozoal medication. I tend to inject that medication in the abaxial muscles or the back of the fish. Rather, there's some thought and theories about doing it intracelomic, which would be into the body cavity itself. I find that that's quite risky, especially if you've got a little clown, putting a needle, even how small it is, putting a needle into the abdominal cavity, you're likely to perforate something. Whereas even in a small fish, that musculature along the back is quite dense. So even if I'm using a small insulin needle, I know where that medication's going. A lot of times you have to be careful with injections into that musculature because that tissue is quite dense. So you want to use a high concentration. So there's different concentrations, let's say for metronidazole that I use.
Tell me a little bit, because I've never injected metro into a fish. What is that dose? Hypothetically.
So hypothetically, I start between 5 to 10 mg per kg. So a lot of
5 to 10 milligrams
per kilogram.
Per kilogram.
That's where I start with. Again, I don't recommend people going home and injecting willy-nilly. Like that's something that needs to be, I guess, essentially preserved, because a lot of times people, hear, medication, or they'll go, oh, I think it's if you think it's Uronema or you've confirmed via microscopy, great. But if there's something else going on and we're injecting fish, one, you're probably not going to treat the active infection. And two, now we're creating resistance again. So again, I'm very strict in terms of my metronidazole use. Again, because there is developing resistance, especially with every antibiotic in every field, there's developing resistance. So I like to make sure that I know exactly what I'm treating. I know exactly the weight of the animal I'm treating and exactly the concentration I want to treat.
Now, let's say I don't know the weight and I'm not going to inject the fish. Can I overdose metro in food?
Yes. So if you're eating too much, if they eat too much, you're going to see neurological signs. There's no way. And also once you put it in the tank, there's no way to really get it out unless you were trying to get all the food out, which is impossible. So again, if you had a little fish that was eating, a large, quantity of it,
of metro,
then you could have an overdose.
And what would happen?
So death. So death is a very real possibility. Especially if they had 5 times their dose, 20 times their dose, we wouldn't even know until we started seeing, rapid swimming, or even sudden death.
So you get a chromis or a few chromises, they die off, they had the red bands, it's in your tank. What do you do?
So it's a challenging one. Can you take the fish out? If not, then keeping stress to a minimum is is the key, because we can't add antibiotics, we can't add formalin, we can't add copper to a fish with a tank with coral. If there's no coral, different story, we can treat accordingly. If it has coral in it, your best bet is one, stress to a minimum. So don't decide that day that you're going to re-aquascape and move a bunch of corals around and stress everything.
Don't go out and buy new chromis right away either, right?
No, absolutely. Keep feeding very regular, maybe even feed a little bit more, keep everyone, nice and healthy. Hover around your tank, constantly looking, shining a flashlight, stressing everybody out. Again,
can you lower the be siphoning more and lowering the detritus count? Does that help?
Yeah, so that'll definitely help. That'll help for multiple different reasons. One, that'll help with Uronema. Again, that's just another essentially pile of food for them to eat.
Right.
But also with other bacteria and other unwanted parasites, that's never a bad thing. Removing detritus is always a phenomenal thing. Having a bare bottom tank, which I don't personally like in terms of aesthetics, but in terms of
it helps Uronema
for sure.
Yes, it does.
It's one of the best ways of seeing if there's anything on the bottom, or preventing food from accumulating in the sand bed and preventing essentially these little factories of these infectious protozoa, not just Uronema.
Let's talk about the other problem that comes with Uronema and other diseases like flukes. Secondary bacterial infections.
Yeah.
I know we're going to be talking about bacterial infections on a separate episode, but let's briefly describe why these secondary infections happen and what are you doing about it?
Yeah, so in terms of Uronema, Once you have that ulceration, that's now fair game for every other organism in the tank. So now you're going to have something called a mixed infection. So it's not going to just be Uronema. It's not just going to be, gram positive or gram negative. It's going to be every microbe that can feast on that fish is going to now infect that fish. So that's something called a mixed infection. Those become, increasing.
It's even scaring me, and I keep fish alive pretty good.
No, it becomes really challenging because now, in terms of antibiotics, one antibiotic may treat one of them, but not the other one. So now you have to start again. That's when I really like to send out for culture. So what I do is I take a sterile swab, I send that out to a lab. The lab actually will grow that culture medium and let me know exactly what species of bacteria are present. And at the same time, they'll test a bunch of different antibiotics to all those species that are present. And they'll let me know, okay, all of these are susceptible to X antibiotic. Or it'll be like, oh, this fish or this, infection is resistant to X, Y, and Z, try this. So again, that's the key. Once we have an open...
What would you throw in the water just in case? What would you do? Nitrofurazone, Metro combo with Canna? Let's suppose there's no injections around.
Yeah.
What's your antibiotic of choice, broad spectrum, in the water?
It's a really challenging...
I know it's a tough question.
Because
there's no right answer, right?
There's no right answer.
But the broader the spectrum, the better your possibilities are.
Yeah. So I tend to stay away from multiple antibiotics unless I have to.
Okay.
Having multiple antibiotics, one, there's certain reactions between antibiotics that'll actually cancel each other out. So more isn't always better. One broad spectrum may be effective for one, group of fish, but if we have a mixed infection of something completely different, it may not be effective as always. So that's why, again, I always, when I'm using antibiotics, I always either go at a bare minimum, because I like to scrape, look under a microscope, and then I'll stain, is it gram positive, is it gram negative? That's the basis of, identification, because certain species of gram positive will respond better to certain antibiotics, whereas gram negative will respond better to other antibiotics.
Of course.
It gets really complex, and that's why I think
we're going to have a separate talk about
episode on that.
Uronema, something, guys, not easy to deal with, and not something you want to have if you can prevent it. It's almost, anthias are the most beautiful fish and prevalent in all the reefs, but getting them through quarantine
is very difficult.
Is not easy, and chromis it's almost not even worth it.
Yeah, no, I would always, even if in terms of quarantining chromises, I would always be super cautious. There's no reason to, throw in a couple chromises and then now we've got a disaster on our hands. It's just, certain species, every species should be treated, the exact same. But in terms of efforts and costs and time, chromises, a lot of times we put in a lot of effort for not a lot of gain. And now if we infect a tank like this, now there's, potentially large amounts of fish could pass from it. So I'm very cautious with the chromises. It's almost, again, if we had 10 chromises, I would bet I'd find Uronema on 2 or 3 of them at least. Again, sometimes you get lucky with a batch, and then other times every single one of them has.
And even the anthias, the different species, like, I find it less in squamopennus and more in purple queens. Yeah. Like even that, Pictillus will get them.
For sure. Again, every fish can get it. Some of them just seem to get it a little more frequently.
Right. It is interesting, though, that it can present itself in dull gray skin.
Yeah.
The more I think about it, some of the fish in quarantine that I've lost that I thought looked bacterial because the skin, whatever. So that dull appearance on the skin, that not vibrant, may not be a bacterial infection. It could present as it could be Uronema.
Absolutely.
So it's possible you may have to treat for both.
Yeah. Hopefully, in certain cases, if let's say we're doing the metronidazole dosing, is the metronidazole sufficient to kill the mixed part of the infection? A lot of times it is. But again, that's always, an offshoot. Sometimes, and again, I really try to stay away from multiple different antibiotic use. But again, sometimes, if I need to, injection of metronidazole, injection of enrofloxacin. That, again, is extremely broad spectrum. But again, I try to stay away from that as much as I can. But if, they're not resolving or they're not responding, then sometimes I'll add in another medication.
All right, let's move on to flukes. Something that's a little more simple, but difficult for the human eye to see.
Yeah, absolutely. Again, it is hard to see with the naked eye. A lot of the times they're clear. Something you can do is if you put them in like a 30-second freshwater dip, sometimes those fluke will turn either opaque or you'll start seeing them kind of flake off. And that's something really easy to see at home. And then, it's almost a definitive diagnosis for fluke. You see all of a sudden you a black tang, classic, put it in, now it's got white spots all over it. Most likely fluke, especially if you start seeing them peel off. So that's not something that you really need a microscope to 100% diagnose. You can see them with your eyes once they turn opaque. If they're still clear, they can be very challenging to see.
How would you rate freshwater dip versus formalin bath as it relates to fluke? Just those two things.
That's a really challenging one. Freshwater dip, I think, is more irritating, and you see the fluke coming off. Formalin baths are also effective. I think there's better, if we're going down the medicated road, I think there's better medications. If you don't want to use medications, or you don't have medications, you want to go for a more natural approach, then I think I'd go with fresh water. So fresh water, again, may not get them all, but it'll also drop the parasite burden considerably. Whereas formalin, again, could kill a good portion of them, but there's other medications we know are more effective. So I think the question is really rather of, do we medicate or do an all natural approach? All natural approach, again, is fine. You may not get them all. You may need multiple baths in sequence. Whereas formalin, the other medications have been proven to be more efficacious. So in that regard, I guess I would lean towards, if it was only between those two, I'd try the freshwater baths first. One, because also there's less risk to the fish, less risk to yourself, less.
Do you think it's more stressful on the fish?
It's a really challenge. That's also a really challenge. Again, also, what type of fish should we do?
Right.
That's, if formalin sensitive species, I always go freshwater. If it's a species that really has difficulty regulating salt levels, which is really hard to determine, then I'd go formalin. And also, what concentration is the formalin? What concentration is the fresh water? Is it completely fresh water, or is it just diluted down?
Right.
So again, there's too many variables in that to say one is better than the other.
Right. You can also lower the salinity.
Yeah, exactly.
And do hypo.
Yeah, so that's what I was talking about the bath. Is it fresh water, or is it somewhere in between salt water?
Right. But you could even do hypo in the quarantine tank.
Yeah, absolutely.
If you want for flukes.
Yeah, absolutely. And again, it'll get a good portion of them.
But not necessarily.
And the problem is that even with medications, there are instances, and there was a really nice lab, I believe, in Chile that did an experiment where they did immunohistochemistry. And what they did is they created essentially immunoglobulins or antibodies that only bind to fluke. So they're very specific in their binding. But on those antibodies, they also had a fluorescent compound so that it would bind to the fluke, and then they'd shine a black light and they would see where the fluke were on the fish. They also determined in that study that there are species of fluke that go underneath the scale. And once they're underneath the scale, they're not in contact with medication anymore. So they're not in contact with, freshwater, they're not in contact with the formalin, they're being protected by that scale. So it's only until those fluke emerge, either to lay eggs, give birth, or for whatever reason are moving, that they could be there for, essentially their entire life. So treating for fluke within the fish or within the scales can be incredibly hard. And the only way to actually ever find them is one, through necropsy, of painstakingly go through every scale, or doing that, fluorescent chemistry, which isn't something that most people can do at home.
Right. Tell me about what the average hobbyist should do to prevent the flukes going in their tank. Dosing Praziquantel in the quarantine tank.
Yeah, that's always the best solution right now. I don't think there's a better solution. It's been over and over again. I've seen there's over 3,000 different species of fluke. A lot of them, anything ranging from the size of a pinhead to half a centimeter. So there's a huge discrepancy, but 90% of them, even higher, are responsive to the Prazi. Sometimes you may bump that dose a little bit up. Sometimes you may be a little longer duration, but Praziquantel right now seems to be the best bet in terms of treatment for these guys. So that's what I always tend to lean on. Again, I would never add it to a coral tank. I know there's been some debate about adding that. I would stay away from it. I really, really don't like adding, any medications to my SPS reef. Again, I think that's a really high risk, and I value my acros. So I really don't like to add medications to a reef. But if you are able to get them out, or you're able to have a quarantine Prazi, it's just the way to go in terms of fluke treatment.
And let's talk about the life cycle of flukes and why you have to dose the Prazi multiple times.
So Fluke life cycle is broken up into two components. We've got viviparous and we've got oviparous. Oviparous meaning they lay eggs. Those eggs are either drop off the fish and then they become free swimming, find a new fish. Viviparous is all on the fish. The entire life cycle happens on the fish. They actually give birth to live young. So they're already ready to go. So if we're treating, if we don't know if it's viviparous or oviparous, and one of the only ways to really identify that is if you look under the microscope, sometimes in a viviparous monogen or fluke, you can see an actual embryo and you can see them inside the fluke. That would be the only way I would ever say you've confirmed it's viviparous.
What happens, what's the difference in terms of treatment?
So in terms of treatment, viviparous are much easier to treat because if you killed everybody in that first
round, again, everybody's done.
I always do subsequent treatments, but again, that's much easier than now we're dealing with an insistent state and we're dealing with a worse life cycle. Because there's no egg, because they don't leave the fish, there's a lot easier in terms of the treatment. So those, again, you can get away with one, I always say two, but if we can't identify, the difference with them, I always assume the worst. Prazi seems to be fairly tolerable with fish. Multiple baths, I haven't seen a problem with it. So I always just assume the worst. And I always assume that they're viviparous. that they're oviparous, that they lay eggs. So then, you have to wait for one for those eggs to hatch. Two, you have to wait for, them not to be under the scales. So let's say we treat once, we killed, 95%, there's still 5% left, and there's still now another 10% get added because they hatched. So the next time we treat, let's say we killed 50% of that or 75% of that. So each time there's going to be less, essentially coming back onto the fish. So that's why, again, we always treat multiple times. Again, sometimes there's maybe a little bit of resistance. There's one that, didn't end up being killed by the Prazi. So now we did another bath and now this bath was able to kill it because it's multiple exposures, multiple events of toxicity for those fluke.
And when you say bath, are we talking about baths or are we talking about it in a quarantine tank?
So I like more of like a long-term immersion.
Right.
But you can do baths, but long-term immersion is the way.
So quarantine tank.
Yeah, exactly.
What would be the minimum times you would Prazi so that it doesn't get into your tank?
The number of dosages?
Yes, minimum.
Absolute minimum to be safe, I would say at least 3.
3?
At least 3. One bath, 7 to 10 days later, another bath, 7 to 10 days later, another bath. Again, I tend to be more, cautious with dealing with parasites because it's just not worth the risk. Having them in quarantine for another week, giving them another bath, if you especially, I always, again, microscopy, I scrape and look between every bath. Even if I don't see any, I'll still bathe again. Again, it's just not worth the risk of creating a problem because now getting fish, getting fish out of this tank is impossible. So I like to be 100% certain that there is no parasite, there is no monogene present.
And the dosage?
So I always start at 9.5 milligrams per gallon. So I have to do the math and see the concentration of. So it depends if you're using Prazi Pro or if you're using other brands of Praziquantel. So I always like to say keep it at a standard, so at 9.5 milligrams. So regardless of the solution you're using.
You have a 300-gallon tank. Mm-hmm. How much? What's the dose?
So I would multiply 9.5 times 300.
Where do we stand on eye flukes?
A lot of times we do get secondary infection in the eyes.
Right.
I'm really hesitant in messing with the eyes. And that's something that may be a little controversial because a lot of people or a lot of in the industry really like to get obsessed with the eyes. And I feel like, again, trying to drain the fluid, trying to drain the gas. Again, I feel like that's really high risk. A lot of the times, and also when we're, netting these fish out, I find that if they have a little bit of, ocular edema or any ocular swelling, it gets stuck on the net, it rubs on the net, and now we make that trauma worse. So I really stay away from messing with the eyes, and I found that the vast majority of the time the swelling goes down
by itself.
Yeah, exactly. Especially if you've removed the initial insult. If you don't remove the fluke, that eye is never going to go back to normal.
Right.
But if you've removed the fluke, they're not showing any other signs of secondary bacterial infection. I just let that fish be. The more that you touch it, the more that you handle it, the more that eye gets rubbed on something, the longer it's going to take to heal, and now you're increasing the risk of it getting infected.
All right, let's talk about internal nematodes.
Now we've reached a real problem. Praziquantel is not going to get in the fish.
Right.
You can try like oral fenbendazole or Panicure. Those are very, very broad spectrum deworming agents. as you've said, you've realized that the panicure or the fenbendazole is quite palatable to the fish.
It actually smells like blueberries too.
So again, if they're eating it, and panicure is generally relatively safe in terms of the mechanism of action and in terms of toxicity effects. Yes, there's always a possibility of toxicity. But again, it does seem to work quite well. It's again, the hardest part of that is diagnosing the internal nematodes or in diagnosing the internal monogenes. That's the challenging part. Again, is it coming out of an orifice? Can you see one coming out of its butt? That's where.
Would you do it as a preventative?
So I try to not prophylactically treat unless I have to. Using these medications inappropriately or all the time is how we develop resistance. It's how we're creating unnecessary medication exposure. So I tend not to do that unless I've seen signs. So let's say, I got a batch of fish in, one of them passed away. I did a necropsy. I found gastrointestinal disease. Then I may be more inclined to, but I don't use medications unless I have, an overt reason. The only two that I use without knowing what I'm treating for is copper and formalin.
Tell me what signs people should look for flukes. The yawning, the scratching, give me the typical signs.
Everything you just described there.
Right.
Beautiful. Those
the little shake, the head shake.
Exactly. Those are very typical for any ectoparasites. And if you see clouding of the eyes, or even if you see fluke on the eyes, you can sometimes.
Like clouding of an eye does not necessarily mean bacterial infection.
Exactly.
It could be a fluke.
Exactly. You can see ulcerations. They look very different than Bruchinella and Uronema. They're more like looks almost more like an abrasion rather than like a deep ulcer. That would be another one, and that's most likely seen what's called capsulid monogenes. Those will cause, essentially they have hooks on them, and as they hook, they'll start tearing up the flesh a little bit.
I've seen almost like little pin.
Yes, exactly.
Like a little toothpick sticking in a fish.
Yeah, so also pin-like hemorrhages as well. So you have little focal points of red spots. That would be definitely an indicator, especially if those red spots, bacterial infections will start like that. But again, bacterial infections are either going to go away or they're going to get worse. Whereas those types of pinpoint hemorrhages will stay consistent, and you'll see that for days in the same fish. And that would be another indicator that they're present. But the scratching, the flashing, those are all huge indicators of there's some sort of external presence, external parasite. There's
swimming in the flow.
Yeah, so that's if they're in the gills.
Right, they're in the gills.
Neobendina is a type of monogene that's really, essentially goes for the gills. And that would be, anything that's preventing oxygen or oxygenation, they'll swim in the flow.
Including velvet.
Yeah, no, exactly. Anything that attacks the gills, you'll see signs like that. You'll see the rapid gasping. You'll see potentially even gulping at the top of the surface.
Right.
You'll see them in flow.
And as long as we're just talking about Praziquantel as a general solution, are you doing the Prazi first, or are you doing 2 weeks of copper and then Prazi? Are you mixing the two meds?
Yeah, so
where do you stand on that?
Yeah, again, everything with me always starts with a scale screen. Everything based on that goes, okay, what are the organisms I see? If I see flukes overtly and I don't see anything
then
else,
you're going after that.
I go right for the Prazi.
Right.
Again, if I start seeing Uronema and flukes, and if I start seeing really a mess, it's going, okay, what is the most life-threatening organism?
Right.
And again, that would be the Uronema in that case. So again, it's always identifying what diseases we're treating. And that's the biggest, takeaway for you guys is what are we treating? If you don't know what you're treating, then that's when I go for the formalin, I go for the copper. Again, that's not always efficacious for bacterial infections, but again, you should see signs of a bacterial infection that would make you go, okay, now I need antibiotics.
Let's suppose that happens. I know we're doing the whole antibiotic bacterial section. When do you weave off and go and say, oh my God, I got to do the antibiotic route and not do the copper route?
So I'd always start with first, if we see, if we have overt flukes and you start seeing an ulceration, first always, again, if we didn't have a microscope, honey, or I use like a cellulose compound, betadine, basically sterilize that ulceration. If that ulcer, looks good, and like say the next day, keep the Prazi going, keep treating, and that'll heal by itself over time, as long as it doesn't get secondarily infected. If, you're applying honey, and you apply honey, once a day, once every 2 days, really depending on the ulcer.
Someone asked me that question, how often do you have to apply the honey? What is the answer?
Anywhere from 12 hours to 48 hours, depends on how much flow you have.
That's a lot of netting and honey.
Yeah, but again,
how do you write the honey on? Just with your fingers?
so I use either a Q-tip Or it's like, I call it like icing a cake. I'll put a little bit
The
of
little, like
yeah,
an ice cream, like a wood spoon.
yes, exactly. A little bit. Again, not applying too much pressure.
Right.
But again, it really depends on how much flow is in that tank and how much, essentially the fish is always exfoliating. Is it exfoliating off? Are they rubbing it off? So anywhere from 12 to 48 hours. The thing is, if you have a big ulcer like that and you don't apply the honey, the fish is going to be dead within 12 hours anyway. So again, it is stressful, but you don't have an option. The fish will pass from that ulceration faster than it'll be able to heal itself. So the honey is just providing time and creating an artificial barrier until the fish can have its own barrier formed.
Black Ick, not something a lot of people are actually aware of.
Yeah, it's not something that I see a lot of.
Not a lot.
But when you do see it, you'll never forget it.
Yes,
You'll
that's true.
You'll always know what it looks like, for sure.
It's worm. So why don't you explain what it really is and what it responds to?
Yeah, so it's similar to monogenes. They're called tribulines. My pronunciation is a little bad on that. Essentially very similar to Fluke or similar to monogenes.
Right.
They're slightly different class. Also, a worm type of parasite.
Right.
Again, Praziquantel, medication of choice for these guys.
How many times would you dose that for those?
Treat it the same way that I treat
Several times.
Yeah, I always do, because again, you miss one and now we're dealing with this problem all over again.
Same thing, 7 to 10 days?
Yep, I do the exact same, so 6 to 10, 7 to 10. Again, same, very similar.
Same dose?
Yep, I'd start with the same. If you don't see, again, since Black Ick is something that we see less commonly, there hasn't been as many people going, oh, this dose is very definitively to work. Again, it's only something I've seen a couple times, and again, the dosages have worked, but just because we're saying Black Ick doesn't mean that there's not 5,000 different species of Black Ick that could respond differently.
And it does present differently in the.
Yeah, absolutely. It's a lot easier to see.
I mean, I've seen it like pepper and freckles, and I've seen it as discoloration.
Yeah, exactly. So a lot of times if we have external, trauma or external parasitism, you'll have discolorations. In terms of the peppering that we see, again, that makes it very pathognomonic. You see a yellow tang covered in black spots, most likely it's going to be the Black Ick.
The tangs seem to get it the most.
Yeah, most frequently, it's definitely the tangs. And it's also fortunate, you've got a yellow tang, it's very easy to see.
Right.
And you got a black tang. Now you're like, oh, you're looking at him and he's flashing, he's scratching, he's like, something's wrong.
Can you see Black Ick on a black tang?
Not really.
Not really.
No, it's very, very difficult. And that's when you have to, that's when you take the fish out and then scale scrape. And then you definitively see it. I feel like, I haven't seen it in a black tang personally, but I feel like if in those types of scenarios, it would get really bad. And then you start seeing, what's wrong with the fish. Then you scrape and you probably see a pretty significant infection just because they're so hard.
What does it look like under the slide? You actually see the worm?
So no, you can actually see the definitive, tribuline. Again, it's not very exciting. Looks very much like a monogene, just very pigmented, much darker. Unfortunately, I don't have any pictures for you guys for this.
Right.
Fortunately, all the other parasites, we've got a lot of nice pictures
Right.
for. This is one, again, it's not one that we typically see.
And if you're treating for flukes anyway, prophylactically, you're going to get this anyway.
You should. Yeah, no, absolutely. Again, unless there's some, a new species that, has a higher resistance, the dosages to treat for the monogenes would treat for the fluke, would treat for the mono.
What else? Would formalin bath would work for Black Ick or no?
It's going to be the same with the monogenes. Potentially, formalin's just really toxic to everything. Again, freshwater bath may help a little bit, but in terms of the tribulines and the monogenes, Praziquantel is the way to go. It's just, again, it's one of the few times you'll hear me say, here's the definitive treatment. This is what you do. This is the medication you use. Again, everything else is a lot of variability, in terms of, as we spoke before, with the ick, different ways to go about it. Uronema, a lot of different ways to go about it. With the monogenes, yes, there's, different options, but the Praziquantel is the way to go. If you're into more holistic or natural, then freshwater baths, and I feel like those are your only two options. Freshwater baths, Praziquantel. Praziquantel, much more effective. Formalin, freshwater baths, not as effective, but have their place, have their purpose. And again, if you're really against medication, that's the way that you can always go.
Why don't we just review how to do a freshwater bath for people that don't know how to do it?
Yeah, so either start with, 0 salinity or 1.0.
RO water.
Exactly. Make sure it's at the right temperature.
Temp.
Make sure it's oxygenated.
Oxygen.
Place the fish in. again,
Do you like to buff the pH to the equal, or the fish not is the fish not in there long enough?
it's not in there long enough. Again, if you want to, you can.
Little pinch of baking soda.
It's just another level of complication. What happens if you add too much?
Oh, I've seen that, and and it's 9.0 pH.
Yeah, exactly, and that's when I'd get more concerned. So again, it's a really short bath, and I almost want essentially a little bit of that pH shift to also help with the parasites.
Let's discuss one last issue: Prazi resistance.
Resistance is a huge topic in every aspect right now.
Right.
Overall, I haven't, seen a lot of resistance. I've had people, say, "Oh, the Prazi wasn't working," but my question to them first is, "Was your skimmer running? Did you add the right dose?
Did you have carbon in you?"
Exactly.
Right.
So is it user error or is it actual resistance? Again, and I wouldn't add it to a reef tank. I know that's been something that's been up for debate, but right now, until I see,
I know some guys that think corals look better and fluffier and more polyps after.
Yeah, again, until I see more definitive evidence, I recommend people to do.
And the guys that dose interceptor,
Yeah.
instead of the actual mice, right? They're getting Prazi in the reef tank.
No, they are. Fortunately, that's at a very small quantity.
All right, great. This was a terrific conclusion of these diseases, and we'll do bacterial infections next.
Yep, absolutely.
And then we'll do a little bit about dosing the meds.
Yeah.
And then coral disease.
Yep, sounds like a plan.
Until then, Polo Reef, Dr. Hall, thank you so much for being here.
Thank you.
Appreciate it. Good night, everybody. Good day.